Did you know, in some parts of the world, the rate of thyroid cancer diagnosis has tripled in recent decades, yet the death rate has stayed almost perfectly flat? This shocking fact opens a difficult conversation. We live in a truly amazing time for medicine. We have powerful new technologies, incredibly detailed body scans, genetic tests that can peer into our DNA. These tools find diseases earlier than ever. They help doctors save lives. They give many people longer, healthier futures. This is the promise of modern medicine. But every powerful tool has a flip side. Sometimes these advanced tests find things that look like disease, but aren't. They spot tiny, slow-growing abnormalities that would never cause trouble in a lifetime. When we give these harmless findings a scary name, like cancer, and start aggressive treatments, we cross a dangerous line. This phenomenon is called overdiagnosis. It's diagnosing a disease that will never cause symptoms or death. It's turning a healthy person into a patient, not for their benefit, but to their potential harm. This idea feels strange, even counterintuitive. We're taught that earlier is always better. We're encouraged to get screened, to get tested, to be proactive about our health. The thought that a diagnosis could harm rather than heal is unsettling. It challenges trust in the medical system. Yet a growing body of evidence in the world's top medical journals shows overdiagnosis is real and significant. It creates hidden costs that affect our health, our wallets, our peace of mind. Understanding this is vital for every one of us. It's not about rejecting medicine or fearing doctors. It's about becoming smarter patients and building a wiser healthcare system. It's about learning to ask the right questions and knowing that sometimes the bravest choice is to watch and wait. This is a journey into the heart of modern medicine, where we must balance the incredible power to detect with the wisdom to know when not to act. The stakes are incredibly high: our health, our well-being, and what it even means to be sick or well. We really need to think about this. To understand how we arrived here, we need to look back at how medicine has evolved. Not so long ago, a diagnosis was primarily based on what a doctor could see, hear, feel. They listened to your story, symptoms. They used a stethoscope to listen to your heart, lungs, and their hands to check for abnormalities. Diagnosis was an art, a careful process of observation and deduction. The threshold for disease was high. You generally had to feel sick to be diagnosed. This approach had its limits, and many serious conditions were missed until it was too late. Then came the technological revolution. The 20th and 21st centuries brought an explosion of diagnostic tools. We developed X-rays, then CT scanners, and MRIs that could produce stunningly detailed three-dimensional images of our insides. We created blood tests that can detect microscopic markers for hundreds of conditions. More recently, genetic screening has allowed us to identify predispositions to diseases before any signs appear. This drive for early detection became a central mantra of modern healthcare. The goal was noble: find diseases at their earliest, most treatable stage and stop them in their tracks. This incredible power to see more also led to a change in what we define as a disease. Medical experts and organizations began to lower the thresholds for diagnosing common conditions. The numbers that defined high blood pressure or high cholesterol were reduced, instantly labeling millions. New conditions were named for symptoms once considered part of normal life. This phenomenon, sometimes called disease-mongering, expands the market for tests and treatments. Better technology, a passion for early detection, and expanding disease definitions have created a perfect storm for overdiagnosis. Doctors, armed with these tools and a sincere desire not to miss anything, are testing more than ever. They are finding more abnormalities, more incidentalomas, things found by chance while looking for something else. While many findings are life-saving, a significant number represent problems that are best left alone. The system unintentionally encourages action, making it harder for both doctors and patients to choose a path of watchful waiting. Beat. Let's see what this looks like for real people. Maria was a vibrant, 45-year-old teacher who rarely got sick. During a routine checkup, her doctor felt a tiny lump in her neck and suggested an ultrasound, just to be safe. Maria wasn't worried. She felt perfectly fine. The ultrasound revealed a small, 1-centimeter nodule. The radiologist's report noted suspicious features, and a biopsy was recommended. The word suspicious sent a jolt of anxiety through Maria. Suddenly, the world felt different. The biopsy came back, papillary thyroid cancer. Her doctor explained it was very treatable, recommending surgery to remove the thyroid, followed by radioactive iodine. With confidence and urgency, there was no discussion of other options. No mention that small papillary thyroid cancers are common, and studies show most will never grow or cause harm. Frightened by the label, Maria agreed to surgery. It went well, but left a scar. Without a thyroid, she needed a daily hormone pill for life. Finding the right dose was difficult. Fatigue, heart palpitations, weight fluctuations, mood swings. She missed weeks of work and felt like a stranger in her own body. Years later, Maria learned that in places with widespread ultrasound screening, diagnoses skyrocketed, but deaths didn't change. Autopsies show up to a third of adults have tiny, undetected thyroid cancers. She realized the diagnosis and treatment hadn't saved her life. They took away its quality. The tiny nodule that would likely have stayed harmless had, through diagnosis, caused immense suffering. Well, it's a tragic outcome. One of the greatest hidden costs of overdiagnosis is the direct physical harm caused by unnecessary medical treatments. Every medical intervention carries risk, from the simplest blood draw to the most complex surgery. When treatment is necessary to save a life or alleviate suffering, we accept these risks. But when we treat a condition that was never going to cause a problem, any harm is unnecessary. Consider the journey that follows an abnormal finding. A diagnostic test may lead to a biopsy, an invasive procedure that can cause pain, bleeding, and infection. If that leads to a diagnosis, next steps often include surgery, radiation, medication. Major surgery carries risks from anesthesia, blood clots, and damage to nearby organs. Radiation can cause fatigue, skin damage, even raise long-term cancer risks. Medications can bring side effects, some mild, some debilitating. The financial costs are staggering. Billions spent on tests, procedures, medications that provide little to no benefit. This isn't just a number, it's wasted resources that could fund essential care, research, clean water, nutritious food. Overdiagnosis burdens the system. Longer waits, clinics filled with low-risk follow-ups, exhausted staff. It consumes time, money, and attention that could be better used elsewhere. So we really need to pay attention to that. John was a healthy 62-year-old man who enjoyed retirement, gardening, and playing with his grandchildren. At his annual physical, a PSA test, presented as routine, came back slightly elevated, prompting a urologist referral and biopsy. Results: a small, low-grade prostate cancer. Options: surgery, radiation, and a briefly mentioned active surveillance. Overwhelmed by the word cancer, John felt doing something was better than nothing. He chose surgery. The surgery removed the cancer, but left permanent urinary incontinence and erectile dysfunction, straining his relationship. Widespread PSA screening increased diagnoses dramatically, but had only a small impact on deaths, because most screen-detected cancers are slow-growing. For every life saved, many men are diagnosed and treated unnecessarily, enduring life-changing complications for a cancer that wasn't a threat. A heavy price to pay for a diagnosis that did more harm than good. Beyond physical and financial costs, overdiagnosis inflicts a profound psychological wound. The moment a person is given a medical label, cancer, prediabetes, high risk, their self-perception can change in an instant. A persistent hum of anxiety colors daily life. Every minor ache can feel ominous. Worry is amplified online. Reliable data mixes with frightening anecdotes and worst-case scenarios. Constant self-monitoring can become an obsession, cyberchondria, deepening anxiety. The label ripples through families. Spouses grow overly cautious. Friends fall silent, and the diagnosed person may withdraw. They become a cancer survivor or a cardiac patient, labels overshadowing roles like parent, artist, friend. Chronic stress can weaken immunity, disrupt sleep, and raise blood pressure. Hypervigilance makes normal sensations feel threatening. The psychological harm of an unnecessary diagnosis can create new, real health problems, fulfilling the label's prophecy in a tragic and preventable way. Finding our way back. Solutions for smarter healthcare. The problem of overdiagnosis is complex, but it is not unsolvable. We can take clear, practical steps to create a healthcare system that is wiser, safer, more patient-centered. The journey begins with education and communication. We need to empower patients with better information. Doctors and health organizations must be transparent about the limitations and potential harms of screening. Use plain language and absolute numbers, making clear that a positive result doesn't always equal a life-threatening problem. We need to reform guidelines and incentives. Financial ties to pharma or device makers can bias toward more testing and treatment. Independent panels should weigh benefits and harms. Shift payment models to reward value and outcomes, not volume. The era of doctor's orders is over. Decisions with trade-offs must be conversations. Doctors should act as advisors, presenting options, evidence, uncertainties, so patients choose what aligns with their values. Invest in long-term studies, asking not just if we can find disease earlier, but whether it helps people live longer, better lives. Refine screening to target those at highest risk while avoiding over-testing low-risk populations. By focusing our tools intelligently, we can harness incredible benefits while minimizing unintended harms, ensuring medicine truly serves health and well-being. David's CT showed a 1-centimeter lung nodule, a common finding. His doctor explained most are benign, used a risk calculator, less than 1%, and laid out biopsy versus watchful waiting. There was no single right answer. David chose watchful waiting. Follow-up scans were unchanged. He avoided a cascade and lived his life. We stand at a remarkable moment in human history, armed with medical technologies our ancestors could only have dreamed of. We can scan, screen, test with astonishing precision, uncovering the earliest whispers of disease, saving countless lives. But more is not always better. The same tools can harm us by turning healthy people into patients, creating anxiety, delivering unnecessary, damaging treatments. Overdiagnosis is not a failure of medicine, but a call for its maturation toward wisdom, patience, and restraint. Some diseases are labels for problems our bodies would manage. We must preserve quality, not only quantity, and avoid iatrogenic harm. This cultural shift involves all of us. Doctors recommending watchful waiting when appropriate, systems rewarding thoughtful care, patients becoming curious and courageous. We must learn to ask, why is this test needed? What are the risks if we do nothing? What does this result mean for my life? There is tremendous hope. The conversation is growing in medical schools, hospitals, public forums. Patients are empowered. Guidelines are changing. We can ensure our incredible tools are guided by even more incredible wisdom. Not every symptom needs a label. Learn to ask questions, talk to your doctors, make shared choices. With care and wisdom, we can keep the ones we love truly healthy and safe. Not every symptom needs a label. Subscribe to Kendu Global Files for more 20-minute documentaries that reveal the hidden forces shaping our health and society.